say, you will get a lot out of that clinical placement. It helps you to link things and to be able to visualise things that when you get to your OSCE exam, you'll then be able to actually confidently display to the examiner that you know what those people do and how the different pieces of the jigsaw in the NHS actually come together. So you'll be doing your clinical practice, and then you'll be working in a classroom in most hospitals to actually go through what the OSCE exam is about. So the OSCE exam will last about 2.5 hours in the test centre when you get there. And so in the classroom we will teach you all the different elements. And at the moment it's broken into two halves. We have the AP stations, which is assessment of a patient, planning of a patient's care, implementation, so that means giving drugs or treatment to the patient,
evaluation, and
then evaluation. And all of those 4 stations revolve around a patient. Okay? So it'll be one scenario. So say for example this lady might have asthma. So in the assessment station you're going to be assessing her condition. So how is your breathlessness at the moment? Have you got any pain in your chest? You look quite breathless. I'm going to record your vital signs. So I'm going to record your temperature, your pulse, your blood pressure, your respirations. I'm going to check your saturations. So you do an assessment on your patient in that station. And then when you move into the care planning station, you then write a plan of care for that patient. So you've identified she's breathless, so you write a care plan for the breathlessness. You've identified she's got dreadful backache, so you're going to write a care plan for the pain. So that's a written station, the care planning. That's sat quietly on a separate table, and you're allowed to do that in your own time, well, within the 15 minutes. And then you move on to your implementation station, and you're given a medicine trolley and a prescription chart. And at that point you're expected to give the correct medications to the patient according to that written chart. And so whichever hospital you go into, they will help you to understand the chart, because it's not going to be familiar with you. Make sure that you know exactly which elements come where. If you don't give a drug, where you need to sign exactly. And then you're going to go on to your evaluation station, which is a transfer letter. So your patient now, we've settled her, we've got her on the right treatment, and we've decided we're going to send her to a respiratory ward with her asthma. But you need to let the nurses know on that respiratory ward what care you've already given. So it's a transfer letter which documents everything you've done. So for those 4 stations, it used to be 15 minutes per station. And once you finish one station, you come out of the curtains and you go into the next one. They've made the assessment station shorter at the moment. Because of COVID, we used to have a real patient in the assessment station, but we can't do that anymore, so it's a mannequin. And it's very difficult to record blood pressure and pulse, etc. on a mannequin. So all you do at the moment is verbalise it. But I'm not saying that by the time you do your OSCE exam, they might have reintroduced a real person. So it might go back up to 15 minutes. And then once you've done those 4 stations, you then go on to clinical skills stations. And this, at the moment, is changing. At the moment, you do 2 clinical skills stations, and it will be a range of different skills. So you're performing a wound dressing, so aseptic non-touch technique. You might be doing peak flow reading. You could be given an injection, either intramuscular or subcutaneous. There are a range of different clinical skills you do, all with different time frames, but the shortest is 8 minutes and the longest is 15 minutes. And those 2 clinical skills don't relate to that lady with her asthma. They're completely unrelated. They're just random clinical skills. But you would need to be familiar with the whole range. Now when you're booked for your OSCE exam, you will then get access to that university's website, and on their website they will give you the whole range of documents they use, the timings, and they also made a huge list of recommended reading material that you need to look at and prepare yourself for the exam. So my biggest tip to you is go through that list as soon as you book for your exam. Make sure that you've actually read all of those. And it's things like reading the NMC code beforehand, making sure that you're just really familiar with them, familiarising yourself with a BNF, which is our formulary for drugs, and learning a lot of those common drugs that are going to come up in your exam. At the moment, they're going to extend that exam in August, so it's actually going to be 10 stations, and then we're looking at ethical dilemmas related to it, and we're also looking at research, how you would implement research. But those changes haven't come into place just yet, but that will be an extra couple of stations from August onwards. And I'm not sure quite when your exam is going to be.
From 4 stations to 10?
There'll be an extra 4 stations, yes.
Okay.
So it's going to go up to 10.
So from August. So
From
then,
August.
From August.
But they're written stations and analysis of information related to that scenario that you've got, and a couple of extra clinical skills. But whichever hospital you go and work in, they will have the facilities to support you to practice all of these before you get there. And it's not that you don't know how to perhaps insert a nasogastric tube or do a wound dressing. You do know how to do that already, but the equipment and the policies are going to be slightly different in the UK, so the hospital will just help you to adapt those to the way that the NMC want to see it being given. You already know how to be a nurse. Have you got a question?
And the policy will stay the same if I fail more than 2 stations, I need to repeat the exam, or they will increase
The time?
number of failure? Because before it's 4 stations, and then if you fail 3 stations, you need to repeat all the exam.
No, that's going to be the same. So at the moment, if you fail just 1 station, you only need to repeat that 1 station, and you only need to do that section of the exam, and it's going to be exactly the same. If you fail 3 stations, you have got to repeat the whole thing.
Even after increasing the number?
Yes. Yeah. The majority of people who fail their OSCE, they'll fail on 1 or 2 stations. They're not usual where the people fail a lot of them. And I'm going to go through some of the points.
What's the station? What do you mean?
A station means when you're given the assessment period for 15 minutes and you have to assess your mannequin, that is called a station. That period of time for 15 minutes when you're doing just that activity. And then once you've finished there, you're going to come out, you go next door, and you're going to write your care plan. That is another station. So it's that period of time when you're doing just that one activity.
It's not to do with the train or anything.
No. And I do apologise if I use any Scouse terminology you don't understand. Just ask me. Right the way through your OSCE exam, I would simply, if I was going to take this lady's observations, I would come up and say, hello, my name's Vanessa, I'm going to be looking after you today. I'm going to be recording your vital signs, and I would simply do it. But in the exam, you've got to verbalise everything you do. So, examiner, I'm checking this patient's capillary refill. I'm checking that this patient hasn't got nail varnish on before I put a SAT probe on. And that verbalisation is what is difficult, and that what requires practice, because that's quite alien to all of us. We don't describe everything you do we?
No.
But in the exam you have to. And if you don't describe something, the examiner will actually ask you the question at the end. What did you do when you checked the capillary refill? So I would just suggest that you start practicing at home, and you'll become much more fluid and fluent with the language and the terminology you need to use in that exam. Okay. And that's why I say the practice is really important, because the more fluent you are with the terminology, the calmer you will feel in the exam. And that's really important too. Okay. So, what are some of the common causes of failure? The silly thing is, most people know their job. They know how to be a nurse. They know how to do an assessment on a patient. But when you feel anxious in an exam, you might do silly things. And it'll be things like, you haven't put your signature on the bottom of the piece of paper. You've done everything else. You've recorded the patient's temperature, you've recorded their pulse, you've recorded their blood pressure. All of that is accurate, But in your anxiety, you've missed out your signature at the bottom of that page, and that therefore would cause you to fail. And the most common cause of failure is inaccurate documentation, just something you've missed. There are some other things you need to be familiar with,
Something
like
what?
so
Sorry?
Signature.
signatures are missing. The date, sometimes people write the date differently to the way it is written in the UK. So today is the 5th, it is the 5th, no, it's the 4th today, isn't it?
Yes.
It's the 4th of May.
Yeah.
That's what,
I've had a couple of days off. Because it's the 4th of May today, the way we would write that in the UK is the 4th of the 5th, 21. But in some countries, they follow the format of the American style of writing it. So that would be the 5th of the 4th, 21. And if you got mixed up with the American style of writing as opposed to the UK style of writing the date, that would be an error with the date. And it's small things like that that's important. All the way through the documentation, it will ask you to put either your initials, your signature, or your name. And if you accidentally put your signature in where it asked for your name, silly things like that actually cause failures. And that's why practice and familiarity with the documentation is so important. Just keep using it and practicing again. Okay, other failures, quite a big cause of failure is time. So you know you've got 15 minutes for this station, and in your anxiety to do a really good job, you get a little bit carried away with the patient and you have a lovely chat with the patient, and then suddenly the beeper goes off because you have a small clock just on the table that counts down from 15 minutes. The beeper goes off and anything you've not completed during that station would be a failure. So it's also about training yourself to make sure that you get all the required information in the time scale. And personally, I always teach people to put their signatures and the date on documents first before they start writing care plans, because people get carried away writing a huge big story, and then the last thing on the chart is their signature and the date, and the beeper goes off before they've had time to sign it, so they would fail. On the plus side, if you practice really, really well, and you're prepared for all of these eventualities, this is just about you doing your job. This is just what you've been doing for years. It's just about being a nurse. There might be some other tricky things I would suggest when you go and do your placements on the wards that you start with. A lot of people struggle with the sterile gloves. Okay, so if you're not used to putting sterile gloves on without contaminating them, that becomes quite an issue for some people. So find out which size glove fits you best in the UK and practice putting those size of gloves on, because they might be different to the ones that you've used in your own country. And make sure that you practice the way that it's taught to make sure you don't contaminate the gloves. That's one of the key failures in the assessment station. And one of the other things I've discovered is that when people are very, very anxious, their hands sweat.
Yeah.
Okay, so if that's the case, you need to tell the examiner before the scenario, because you can't get gloves onto sweaty hands. So when it comes to put your gloves on, just say, examiner, my hands are really sweaty. In this station, am I allowed to dry my hands? And they will let you dry them on a paper towel first. And then try and put your gloves on afterwards. So these are the things just to look out for. On the plus thing side, if you're really well prepared, you will be absolutely fine in the exam. Work on your own anxieties. We work on a system where before we start our scenario, the examiner always says to you, would you like me to start the clock? Just a minute, examiner.
Deep breathing.
Get some contact with people.
Maybe.
Contact is very good.
And 3 deep breaths before you start. Get a nice little oxygen rush to your brain so that you're thinking straight before you start. And it just calms your nerves a little bit. If you've adequately prepared for this, you should be confident walking in there. You need to believe that actually I'm a good nurse. I've done this job for a long time, I know what I'm doing, I just have to demonstrate that to you.
Or you can take one 10 milligram Inderal.
I can't recommend that you take medication. The other problem is that, you know, if you do have any medication beforehand, is that going to affect your rational thought process?
Yes.
Yeah.
For your emotion.
Yeah.
One of my girls previously put lavender oil, so if you use any of those sort of relaxing aromas, they're quite good. And when she used to get nervous, she just used to have a little smell of the lavender oil. It was quite calming as well, and that worked for her. But I certainly wouldn't recommend any medication.
How many examiners we have in the OSCE? How many examiners? Only one or
At the moment, they give you the same examiner all the way around each station.
just one?
Just one, and they go with you. But it did used to be different before the pandemic. You would have a different examiner in every station. But I think they will keep the process they've got now. So the same person goes right the way around.
That's better.
It is better. And what is also better is that in every single one of your stations, you have to demonstrate your hand hygiene. So if you think about when you do a wound dressing, you might be cleaning your hands 4 or 5 times during that station. You've got to demonstrate your proper ALIF technique with every single time that you do it. And you need to be able to talk and have a conversation with the examiner as you do it. Now the examiners are very, very sharp, and they will be looking every single time you've done it. But you'll see your examiners physically relax after the first station if you're quite articulate with your hand hygiene, because they know that you're going to get it right in every station after that. Have a little look at this. I'm hoping that whichever organisation you go to work in, they will run a mock OSCE for you, because we, certainly in Liverpool University hospitals, we find this useful. When you go from one station to the next, we're talking about 2.5 hours, and it's going to be longer again from August onwards. And you actually become really quite tired, quite thirsty. So what I recommend is that you have like a cereal bar or something just to give you a little bit of boost of energy before you start the exam. And you take a water bottle with you, and that water bottle goes with you from one station to the next. Do physically stop and have a drink, okay? And the examiners will also let you have a little sit down. You're allowed 5 minutes in between each of the stations, and that just allows you to calm down. Have a drink, hydrate your brain before you move on. The mock OSCE is perfect for actually training you to do that. So a mock OSCE, hopefully your organisations will do this. There will be a day when you come in and they do it under exam conditions. So all of the people you might have worked with before will be examiners, and you will work your way from one station to the next to understand how you behave in a real exam situation. And one of the most important things is that if in this assessment station I have taken head pulse wrong, I've miscounted it, I didn't count it for a full minute, if I realise in the assessment station I've made that mistake, I feel really nervous then, and I go into the planning station, and because I'm still really nervous, I make another mistake. And then I'm even more anxious when I go to the next one. So the mock OSCE is very good for teaching you that when you think you might have done something wrong, you have to forget about it, because you have to be really focused on the next station. And that's why the mock OSCE is so good. It's about exam technique, just like you sat your exams when you were in school.
How many mistakes do we allow to have?
None.
None at all.
There are critical criteria that you're expected to achieve in every one of the stations, and if you fail any one of those, then it is a fail for that station, but you would only repeat that station. So if you had a problem getting your gloves on and you contaminated your field, you would fail that procedure, but everything else was a pass. You just have to go back to the exam centre and do it, that one again. But you are expected to achieve all of the competencies. And the beauty of the exam now is that they actually, when you get access to the website, the marking criteria is on there, so it tells you exactly what they want you to do, exactly what you have to demonstrate. So I would recommend that you read all of that material as soon as you get access.
Sorry, which website?
Which
website?
So whichever university they book the exam for, here in the Northwest we use Oxford Brookes, So they have a test centre in Oxford and one is Swindon, but the university is called Oxford Brookes that run that exam. And as soon as your exam is booked and they've got your name, they give you access to the website, and they put all of the training material, all of the reading material and the marking criteria on there. So you get several weeks to prepare and read that material. And they tell you what they're looking for. So there's no nasty surprises. It's exactly what you expected.
So before that, it's not possible for us access to the website. No, not the moment.
Not until your exam is booked. So when they've actually booked your exam, and bearing in mind when they book an exam, there might be 8 weeks before the actual exam itself, because you have to give them plenty of time. So during that 8 weeks, you've got as much time as you like to read and prepare yourself with all of the materials. And every chart they use in the exam is on there. So you're familiar with what a prescription chart looks like. You're familiar with where you be recording your observations. All of the material you'll need is on there. So they don't hide that. It's just they can't give you access to it until your name is on their electronic system as a future candidate.
Excuse me. Sorry, this
Okay.
this may sound a little bit silly, but I am kind of lost. So when you say you're going to do your exam in Oxford, so then that's where you're going to be working. So you see the procedures. Is that where you'll be going to?
No. So you might be working at Liverpool University Hospitals, but you can only do the exam in Oxford because there are certain universities that run the exam, and there isn't one in Liverpool. So there are only a couple of them. One of them is Oxford Brookes, which is Oxford and Swindon. The other one is Northampton, which is sort of across to the east of the country. And then there is another one over in Belfast in Ireland. So it'll be one of those three. So you have to travel there on the day of your exam, do your exam and then come back.
Oh.
So there was a little bit of travelling involved.
Exactly that day you receive the result of the exam.
Okay, so when you've done your exam, they promise to give you your results within 5 working days of doing the exam. So we've just had a bank holiday. Saturday, Sunday and Monday are not working days, so they wouldn't be counted. But it's up to 5 days after the exam. Now, usually they're quite quick. It's usually about 2 days, quite quick with the results. And they send it to you by email. I would strongly recommend that you check your trash folder or your junk folders on your email accounts, because I've had 2 candidates, for some reason it went into their junk folder and they were panicking thinking they'd failed, and actually when they did find the email, they'd passed. So do check those results in the junk folder as well. But it takes up to 5 days, and then once you've actually got that, as soon as you've got your pass result, it gives you an opportunity to pay your registration fee, and then you'll be uploaded onto the NMC register as a registered nurse. It used to be very quick. You used to get your PIN number in about 48 hours, but because of the pandemic, things have been slowed down and it's been taking a couple of weeks. I'm hoping it will speed up a little bit now that we're starting to come out of some of these restrictions. But you are able to actually put your registration in as soon as you get that pass result.
Assuming that you provide all the other
Yes.
for the English. Because I thought you could submit the English after you've done the OSCE, is that not the case?
Generally, they like you to do your OET first, and then it's the CBT or the OSCE. Now, most people do the CBT before the OSCE, and they leave the OSCE to the very last minute. And that's the normal pattern, but we have had people who've done it the other way around, so they've done OSCE and then they've done the CBT afterwards. I would recommend you try to get your CBT out of the way first, because it's a little bit shorter, a little bit more focused, and then it allows you more time for the OSCE exam, which is more of a practical exam.
How many times can you repeat the exam?
You have up to 3 attempts to pass the OSCE.
During the year?
Any duration within them?
I think it's within 12 months, but I'm not entirely sure. I think it is 12 months. You have to check up on that one. But there is only a 3 attempt rule.
Excuse me, then they move the OSCE. which hospital is supposed to go to do the practice?
So whichever hospital you're going to work at, they will help you with your practice. So I don't know which organisation you're going to, but they will help you with your preparation and your practice, and they will help you to book the exam. And I can only speak for our organisation, so in our organisation you don't have to book the exam, we do it on your behalf.
Vanessa, may I ask
Yeah.
a question, please? You know, during the year, for example, for OET or IELTS, there are a specific time or date during a month. Sorry. So,
For OET.
you know, for OET or for IELTS, my question is, how many times during the year, for example, OSCE exam take place?
The OSCE exams take place every day, except Sundays.
Every day.
They do. I don't think they're open on a bank holiday either. And they will run the exams throughout the day, so from 8 o'clock in the morning would be the earliest time slot that you get to start. And the latest time slot would be about 2:30, so that you finish by about 5. They run the exams on a Saturday as well.
That's good.
Just to get through the volume of people that are needed.
Thank you.
And as you said, there are 3 attempts to give OSCE exam, yeah? If
Yeah.
I fail once, so I have to wait 12 months.
No.
Yeah.
It's just that I think that there's a 12-month period in which you need to complete it. If you started initially, I think you get up to 12 months to try and repeat your failed stations. Now usually you don't wait that long, and you can normally get a rebooking for the failed stations within a matter of a week or so. Although if you failed a number of stations, I would recommend you give yourself longer to practice. But if you've only failed one station, usually you can get a rebooking quite quickly because your exam is shorter. It's not going to be 3 hours long, it'll only be the half an hour that it takes to do that one station.